personal story. So I worked in a hospital for 6 years as a acute care nurse, and my husband came down with sepsis. If you know what that is, it's a serious blood infection. He was 30 years old. I happen to write also my story in here. I'm going to give it very brief, but it's in this magazine. You can read my story in here. I was pregnant with our second child. Very, very scary. My husband woke up in the middle of the night. He was sweating. He was saying nonsensical things, and I knew when I looked at him and I said, "Oh my God, you have sepsis." I went to the next room. I told my sister, "Hey, watch my daughter. I have to take my husband to the hospital." I put him over my shoulder, pregnant belly, take him to the car, and got him to the emergency room as fast as I could. I lived in Los Angeles, so that was like 5 minutes away. That's as fast as I could get him. They're calling 911. Wasn't going to be fast enough. I got to the ER and I said, "My husband is septic, run a lactic acid." He was admitted to my unit, and basically what he had was a viral sepsis. So for a viral sepsis in the hospital, we do what's called symptom management, or basically we just kind of watch and wait. So we give fluids, maybe we give some medication for the throat pain like a steroid, but there's no real medication for it because it's a virus, it's not a bacteria, so we wouldn't give antibiotics for it. So he was under the best physicians, he was under the best nurses on my unit, and even still he left the hospital having fevers. So his business partner, who's of high net worth, basically said, "Why don't you go take him to do ozone therapy?" And I said, "What's that? I don't know what that is." And so I looked it up, and the first thing you see when you Google it, it says it's a toxic gas that can kill you. And I said, "No, he's not going to go and do that. That's very scary." But he said, "No, go look at the articles in Europe." And I saw that they used it in the hospital, and I said, "Okay, maybe there has some base to it." So I said, "Fine, okay," because it wasn't getting better anyway. He was discharged, still having fevers. There's nothing the hospital could do. We were just watching him, waiting for him to get better. So he did ozone therapy. He got better the next day, 50% better. So I said, "Okay, you know what?" I was skeptical. He probably got some sleep. He was in the hospital. He wasn't working. He was probably eating better. He got fluids, so he probably got better on his own. And then I went and I did ozone therapy when I had the flu, and I was 90% better. So I said, okay, there's something to this. The next year, I basically left the hospital and I started my own practice, and that's why it's called Dr. Ozone, because that's where it started for me. It started from something that was non-conventional, where I had used all the conventional therapies, and there is a time and place where in emergencies you definitely need them, but for most chronic conditions you don't. And so that's how I got to functional medicine, and I basically bridged the best of both worlds. And then another small story is my daughter, she had eczema, and basically we used holistic therapies. I took her to a naturopath, we fixed her gut, and knock on wood, she doesn't have any more eczema outbreaks today, because basically they wanted to put her on a cancer medication, and I said absolutely not, because we had exhausted the steroids and basically everything else that is conventional. I took her to an allergist, all the specialists, allergists, pediatrician. I took her to a dermatologist, and they all basically tried to heal her skin, but they weren't healing her from the inside out. So those are my two personal stories. They start personal from me, from my own family, and that's what I do for my patients, because I think we all kind of deserve that. We deserve to really have somebody listen to us, look into us, and really understand what's going on with our body, because nobody's body is the same. Everybody's very different. The cookie cutter thing doesn't work for most people. So that's my brief intro. So let's talk about what's the difference. So I gave you a kind of a different contents right now from my own personal story of what's conventional versus what's functional medicine. So conventional medicine is basically, it's focused on the disease. So a lot of us know it's a pill for your symptom. We're putting a Band-Aid on it. We're not actually getting to the root cause of it. Functional medicine is more looking at the root cause of what's the issue. That's the difference between conventional and functional medicine from that standpoint. Reactive, so it's like you only go and see a doctor when you have a problem. It's not, let me go see somebody to prevent having a problem. And that's what functional medicine is. We're trying to prevent a train wreck from happening. We don't want to wait till it's too late, or wait till we get to a bad place where something not good is going to happen. Symptom management, so again, just like, you know, a pill for your symptom, putting a Band-Aid on it, not really looking at what the root cause is. And so in conventional medicine, we have specialists for everything. So we have a specialist, we have a kidney doctor, we have a nephrologist, we have a hematologist for the blood, we have a gastroenterologist for the stomach, so it's all very compartmentalized. But we are one human being. All the organs are in our body, they all affect each other. So why wouldn't we take a step back, and why wouldn't we look at the body as a whole? Because that's what we are, right? So I don't love the word functional medicine. Dr. Hyman, he's amazing. He's the founder of functional medicine. He coined that term. He basically was looking the root cause for himself. He had mercury poisoning, if you're familiar with him. And so I like the word more precision medicine because it's more specific to you because we are all different. But there's a lot of different words you may hear: alternative medicine, regenerative medicine. There's just too many different terms out there. But what I just like to think is we like to look at the body as a whole. And again, I'm not against one or the other. I actually fuse the best of both worlds because there is a need for both. Just a show of hands, how many of you have been to a primary care doctor? Raise your hand. Okay. How many have you? Just keep your hand up. If you've gone for a physical exam, just keep your hand up if it's been 15 minutes for a physical exam. 20 minutes. 30 minutes. 40 minutes. Anybody been? And it's okay. It's okay. I'm actually happy. You can have your hand up. You're like, I'm the only one who's had an exam for like an hour. It should be an hour. Okay, when you become a physician or when you become a nurse practitioner, when we're trained in school, it is a 1-hour exam. However, due to the insurance companies and due to other limitations, we're only allowed 20 to 30 minutes. Maybe I have a chance to listen to your heart and lungs. Maybe we have a chance to have a conversation, but I don't have the time to dig deep. How can I ask about your sleep? How can I ask about your stress? How can I ask what you do for work? Maybe something in your environment might be affecting your body in a negative way. How can I get to the deep things that we need to talk about that truly affect your health in 20 to 30 minutes? You can't. That makes me a bad practitioner. And so time is really important. And also, for me, doing the due diligence is really important too. I need that hour because your body gives me information about you. Down from vital signs are vital. I hope you at least get your vital signs done by anyone in the office when you go for a primary care visit, because that's the most important. That's going to tell you if there's something happening or something going to happen if your blood pressure is high. We don't want that to happen. But again, we just want to look at the person as a whole and spend that time and energy. And that's why I love functional medicine in this modality, because I do have the time and I can connect and I can really dig deep into what the issues are and review all the symptoms that you're experiencing too. Sometimes when I worked in primary care, like the first thing we start in the visit is what's bothering me, and I don't have the chance to do the physical exam because we're talking about what's ailing you right now. I don't have that time, but then we have a follow-up visit later and hopefully we can review it later. Sure, if you want, right there is good. Sorry. Okay, show of hands, who knows what biohacking is? You're at a biohacking meeting. I hope you know what it is.
I know what it is.
Can anybody raise your hand, give me some samples of what a biohack is? You can give me an example. Yes, Julie.
Make your internal age younger than your calendar.
Right, so are most people here familiar with Brian Johnson? Okay, what he's doing is an amazing, he's his own clinical trial. It's not feasible for most people. But what he's doing is he's proving the science behind what he's doing. So here, we're sitting in a place that is a biohack. So biohack is biohacking your biology. So yes, reversing aging is one of it. That's what most people want to do here, is live young and be healthy, right? So biohacking your bones is what you do here at OsteoStrong. I come here once a week, osteogenic force on these 4 machines and that vibration machine helps strengthen my bones in 20 minutes. So basically work smarter, not harder, right? We want to do the less amount of time because I'm sure all of us are really busy with our lives here, right? But we still also care about our health because you're all here, right? So we want to maximize that. So red light therapy in this room right here, I have red light therapy on my wrist. So I'm a busy person also. So I'm doing this while I'm doing everything else and I'm walking around with it. So I'm getting my biohack while I'm doing everything else. So red light therapy is a biohack. OsteoStrong is a biohack. Some people take it to an extreme point, like Brian Johnson does. You can do gene editing, CRISPR. I mean, that's on another level. You've got to go to a different country to go do something like that, and it costs a lot of money. But the other thing we can do to biohack is a lot of people have Apple Watches. You can track your data, or you have a CGM, which you put on your arm to kind of track what am I eating that's spiking my blood sugar. So you're getting information. So how am I going to hack? There you go. So Amy up here is wearing one. How can I know what is spiking my blood sugar? That's a biohack. So that's personal to your body. When you eat like a piece of fruit, how high is it spiking my blood sugar, and is it staying that high and for how long? I have a device at home. Anybody familiar with 8 Sleep? Sleep 8? Anybody have one? So that's optimizing your sleep. So it's a smart bed that basically optimizes your sleep. If you listen to any biohackers like Dave Asprey or Ben Greenfield, sleep is everything, right? And you probably already know that within your own life. So it basically adjusts the body temperature to you, so it keeps you asleep. So it learns you. It's a smart bed. It learns you, and then you have one for you and whoever's sleeping next to you, so you can individualize it. But what it does is it keeps you in REM and deep sleep longer. So it kind of learns you. It's warm when you get in. If you want, you can change the temperature, but basically it is optimizing your sleep. And then hopefully after you do that for a while, you wake up really good and refreshed, because that's how we want to feel when we do that kind of biohack. So that's biohacking in its essence. And we'll do some Q&A at the end. I'm sure some people have questions. Yes, sorry, okay, forgot you were helpful. Okay, so cellular health. So what does it come down to? It goes all the way down to the cells. So if your cells are healthy, you are healthy, okay? So our cells are our energy powerhouse. However, there's some things that we have that are offending us on a daily basis, whether it's the air that we breathe. You can have a HEPA filter in your house to clean your air. Anybody have a HEPA filter in your house? Good, a lot of you. So the air that we breathe is really important. So you want to make sure that all the outside factors are not affecting your cells in a negative way. So we want to kind of take control over that. The food that we eat is really important. And I think in one of the next slides we get to that. So, and the core of cellular health is also metabolic health. We are in a metabolic health crisis in this country if we are not aware. So obesity epidemic, pre-diabetes epidemic. I do a test in my office that actually tests you for pre-diabetes, and it tests you for insulin resistance. Did you know that you can find pre-diabetes 10 years in advance? Did most of you know that? By checking an insulin level. It's a very cheap test to do. It's like $5 maybe. That's one test at the end that I would recommend that your practitioner adds on, whoever's seeing you, because that can predict pre-diabetes. So 10 years in advance, that's 10 years before you start having damage to the beta cells. Pre-diabetes is a misnomer in my mind because you already have damage to the beta cells. So in my mind, pre-diabetes is already diabetes. And when people are pre-diabetic, when you go to a primary care doctor, then they're starting, you're not in diabetes yet. We don't necessarily have to do much yet. Yes, you do, because you are having damage. Why are we not doing something at that point? Why are we waiting for you to get into diabetes? We have to be more proactive about our health. So that's a tidbit. Take the note of that as the insulin level. Okay, so bad energy. So go back to the good energy. That is a term coined by Casey Means. Dr. Casey Means, if you don't have her book, Good Energy, listen to that book. If you haven't read it already, she's also running for office for Surgeon General, and I hope that she makes it because she's really got it right. She's really educating the population about the things that I'm educating you about right now. It's preventative health and proactive health and how to get out of this metabolic health crisis. So basically good energy is you want to wake up feeling good. You want to feel good most of the day. You know intuitively if you're feeling good or bad. So what does bad energy look like? Mitochondrial dysfunction at the cellular level. You're having a problem that is affecting your body. It goes all the way from the cells out to the body. Chronic inflammation is something that I look for also on blood work. I check inflammatory markers, general inflammatory markers, and specific inflammatory markers. I want to know if you have inflammation to the body, because inflammation is a root cause for disease. Inflammation will cause disease, and I'm very aggressive about it because I don't want people to develop a disease later down the line. And then oxidative stress is basically having stress to your body. Who doesn't have stress here?
Yeah.
Joking.
We know better.
Yeah. So we all have stress, right? But what do we do about it? So we want to try to do the things, we go over the modifiable versus the non-modifiable factors. What can you change and what can't you change? And then we want to act on that when we talk about oxidative stress, because that's affecting you. Okay, so mitochondrial dysfunction is mitochondria is basically at the cells. It's the energy of the cells. The mitochondria is really important. So what does this lead to? Basically, every disease you can think of comes back to mitochondrial dysfunction and cellular health. It all comes back to the cells. So accelerated aging is one thing that can absolutely happen. Degenerative diseases like Alzheimer's, Parkinson's disease, heart health issues. A big cardinal sign of mitochondrial dysfunction is constant fatigue. So if you're feeling fatigued all the time, that's bad energy, that's not good. So then you need to explore with your healthcare provider, why am I fatigued all the time? There's a root to something about that. Again, some of the threat signals from a medical perspective is insulin resistance. I talked about that insulin level. Fat storage, so that central abdominal fat is something to talk about also. When you see that, when it's growing in your stomach, that is related to diabetes and also insulin resistance, and then inflammation. So those are the three cardinal things I mentioned before. Okay. So what is causing this from our environment? So ultra-processed foods, it's everywhere. I mean, thank God we have RFK kind of getting into office. Some of you may like him, some of you may not, you know, whatever your political stance is, removing food dyes from our environment is really important. It's important for our kids, and it's important for us. It looks like ADHD, it looks like kids who are like enraged. I mean, it does a whole kind of havoc to the body, all these ultra-processed foods. These things are outlawed in different countries. So coffee, right? Coffee has a lot of mold in it if it's not third-party tested. Do you guys know that? Yeah. Okay, so you want to make sure your coffee is tested for mold. When it didn't pass the standards in Europe, where do you think they sent it? So you really got to be really good about reading your food labels and understanding what's in your food. Look at those labels, and of course, it's just really basic. Go back to nature as close as you can to the natural foods where it's not processed. If you can go to a farm, if you can get your eggs from a farm, your meat from the farm, or like a farmer's market. There's not a lot here in Vegas, but that's where you want to go, directly to those small people who really care about their animals and their food, and who are not going to do things that are sketchy with it. Sedentary habits, a big issue. A lot of us are on our computers in this country. We're constantly on our computers and we're not moving around. If you're at your desk, you need to get up every hour and move. 10,000 steps a day if you can make it. If you don't have any other issues, try to do 10,000 steps a day. Chronic stress, we just talked about. I mean, that will destroy your cells at the core. If you're having chronic stress, again, you need to take a look, make a list. What can I change and what can't I change? Or what can I delegate? What can I move off of my plate? Light exposure, the LED lights, I mean, it affects our circadian rhythm. If you can, try to get in the sunlight in the morning. As soon as you wake up, go look at the sun. That's what we did a long time ago, right? We want to go back to the basics. So get that light in your eyes. If you can, try and see that sunset so your body knows it's time to wake up. It's time to get ready for bed. There's blue blockers. I'm not wearing them right now, but Dave Asprey has these yellow glasses that he always wears. Those blue blockers on your eyes or on your screen to block that blue light. Because again, sleep is very, very important. Environmental toxins, plastic. If you have plastic, try to get it out of your environment. Try to use glass bottles. Like your bottles, try to make them stainless steel. Try to make them glass, but stay away from plastic as much as possible. Those microplastics do leach into the water, especially in Vegas when it's hot. Please don't drink that hot water bottle you left in your car. That's gonna leach in there, okay? Also, a lot of people, I see them when I go to the spa, they take that into the sauna and then they drink it. So just, be mindful of the microplastics.
Copper, like Angel has a copper.
Okay, perfect, yeah.
For copper thing.
Copper is fine, just stay away from plastic as much as possible. I do a test that checks for plastic. I see microplastics all the time. Metabolic health, again, blood sugar regulation is so important. There's her book, if you read it, I'm not going to go deeply into that because Casey Means really does a good job of going over that. Make sure you read her book. She gives you really good tips directly on that. Okay, so how do we measure cellular health? So one of the best tests is an OAT test. It's an organic acid test. Has anybody ever heard of that? It's really hard to do because there are a lot of restrictions, and one of them is not drinking coffee. And I can assure most people, including myself, can't do without coffee for 3 days, right? So I don't do the test anymore, but what I can use is other level markers to kind of assess how are your cells doing. So lab testing, fasting blood glucose in the morning is a good indicator of how your metabolic health is, and that insulin level, remember that insulin level. Triglycerides is more important than cholesterol. I'm not talking about heart health today, but triglycerides is more important than cholesterol. Liver enzymes in GGT, that assess for a fatty liver, that is directly related to insulin resistance and metabolic health. And you can check that in your blood work without getting a liver ultrasound. HSCRP and uric acid. So funny enough, uric acid is actually a metabolic health marker. Most people know that because of gout. Most people look at uric acid for gout. I look at it all the time because I want to see if you're having metabolic health issues. Fructose raises the uric acid, and sugar raises the uric acid. So that's how I know if you're having too much sugar floating around in your body. HSCRP is highly specific CRP, which is an inflammatory marker that tests for general inflammation in the body and inflammation in your vascular system. Very, very important. So at minimum, if you see your primary care provider, you can hopefully ask them if they're nice to order these minimal tests. That will give you a good baseline. And then of course I said vital signs are vital. So how are you oxygenating? How's your blood pressure? If you've seen me in my office, you know I'm very strict about blood pressure and what the numbers need to be between the numbers and across the other two numbers. Respiratory rate and body temperature. This all gives us, this is like also what we use to assess for sepsis. So I mean, vital signs are vital. It's very, very important that you know where you're starting at. Some people get nervous when they come see me in the office. I'm a nice person. I don't wear a white coat, but for whatever it is, going to see a medical provider makes people nervous. So I have them also check their blood pressure over a week at home just to make sure that when they don't see me that it's fine. And then advanced testing, those are more functional medicine tests of how your cellular health is working. Epigenetic analysis is what you were talking about, Jillian, is that true age, which is if you're aging or anti-aging. So that gives us an indicator of how your cells are doing. Gut health, you have a leaky gut, you have a leaky brain. They communicate with each other, they're directly related. So I do a lot of gut health testing, and that also is telling me how your cells are working, or not working rather. Total toxin burden, that's checking for pesticides, microplastics, bacteria, virus, parasites, yeast, all the bad stuff, all the outside offenders. So that's a nice test that a functional medicine provider does. And then of course those metabolic assessments is just, you can do body analytics. So I contract with Dexafit to do body analytics. You go on a treadmill, you do your VO2 max. You sit down, how much are you burning by doing nothing? That's called a resting metabolic rate. And then your muscle and your bone, what's the ratio to that? It's called a DEXA scan. It's not the same as a bone density scan, even though it has the same name. That also gives us information of how your metabolic health is doing.
And a quick question on the test. If you go 3 days without coffee, would you administer the test?
Yeah, absolutely. If somebody's willing to meet the parameters of this, I am happy to do it. I just stopped doing it. I don't know, people cannot leave without coffee in this country, except for you two. You guys are the only two.
Me too.
Okay, fine. Okay, I'll do a slow test for you, okay? Yeah, but it just has a lot of restrictions in it. It's hard to do. You have to do it for 3 days and then you do the urine test. So I don't do it because I want to make sure it's accurate. But if you're willing to do those parameters, happy to do the test for you. It's a great indicator of how your cells are doing. It's the best test we have right now. So lifestyle as medicine, you are your best doctor, okay? It's you. I provide the tools, I am the practitioner, you gotta do the work. So at the end of the day, I can give you all the tools, but if you don't do the work, then what is it worth, right? So nutrition, anti-inflammatory, I'm not giving specifics, this is like a general intro. When I see somebody, I make it very specific to them. There's very specific tests to make it just for you. Anti-inflammatory, nutrient-dense foods to support mitochondrial function. Again, just avoid those ultra-processed foods, go back to nature, make it as simple as possible. If you can't read the ingredients, you probably shouldn't be eating it, okay? Environment, reducing toxin exposure. So having the air filter is really important. You know those fragrances in the houses? Yes. Get those out if you can. I mean, those are toxins. That's something that you can willfully do really quickly and just get those out of your house. Those scented candles also are not good for you to smell and ingest into your body. They are toxins. Movement, we're not moving enough in this country, sedentary lifestyle, so remember that number, 10,000 steps a day at minimum. I'm not even talking about high intensity exercise, we're just talking about the minimum here. Get your body moving. If you're at a desk, again, get up every hour and move. And if you have one of those standing desks, some of those offices are really, ergonomic, amazing. If you can be standing at your desk, even better. We talked about sleep. You guys got to know how important sleep is and optimizing sleep. That's a biohack. Hacking your sleep is so important. Sometimes, mostly for females, that's a hormone disruption issue. And then stress management, remember what I said again, what can you change, what can't you change, what can you push off your plate, and if you can't push it off your plate, what can you do to lessen that stress burden? Can you do some meditation? Can you go do some yoga? Can you do brain tap? I mean, what can you do to lessen that stress in your body? So you're gonna have that stress, but how can you lessen the impact where it doesn't affect you in a negative way? Okay, so some takeaways. We talked about, functional medicine is more root cause, whole body. Conventional medicine is more focused on disease management and symptom management. Cellular function, it all comes back to the cells. If your cells are healthy, you are healthy. Practical application, again, I just went over that. Nutrition, movement, stress reduction is key. That's all stuff that's in your hands. That's your power. That's what you can do. Personal empowerment. And then, for your cells, functional medicine and biohacking provide those tools to optimize your cells. And that's it. That's what I said.
I know there's questions.
Just today, I was talking to somebody about cellular health and so forth this morning, and I was trying, so what things destroy cells? And it's like, I know such a movement right now with high intensity workouts and stuff like
The
that.
head
And,
exercise,
Like, how do you find the right exercise to do where you're not creating oxidative stress or damaging the cells? Especially for females, because women, our bodies are different than men, and men can handle more stress. It's nothing to do with bone health. It's just that I was doing it and it was actually destroying me more, like everything. So I'm asking that question because I want to find the right movement to get back into without hurting myself.
I get you.
So
Can I answer that?
Okay, he goes first and I'll go second.
You're already doing osteostrong, so that's already getting you down the road, okay? And she can tell you that. That's already a step in the right direction. We've got you on vibration. Vibration's excellent for you, right? Vibration's amazing for the body. And then we talked about the BFRs, the blood flow restriction bands. So that in combination with vibration, it's going to make it so you can work out nice and easy and short without having
you're
all
right,
that damage.
the bands.
Yeah.
The bands is good.
Yeah.
Very good.
And I'll just add, I'm 71, I work out with the bands, it takes me 6 or 7 minutes, 2 or 3 times a week, and I stay strong. Without damage.
Not working. Go ahead.
Yeah.
So it always needs to be specific to you. So I could give general female recommendations. So like Pilates is a great thing for strengthening bones. Weight bearing exercise is good for strengthening bones and along with osteostrength. This is in addition to osteostrong. However, there's a genetic test that gives you your genetic blueprint that tells you the best exercise for you genetically. So I do that. I do this test when most people start off with me. That's besides the blood work. That's a test I offer too because I want to know what you were born with. It's not your destiny, but what is your blueprint. And so it will tell you if you're more likely to have a hamstring pull, or if you're more likely to your fast fibers in your body are more likely to have an issue than the long fibers. So it's very, very specific tests that can give you that information.
Thank you. That is great.
So again, in general, like with functional medicine, I don't like to give like cookie cutter answers because it is very specific to you. And then also, you're your own best medicine, right? You kind of know what worked and what didn't work, right? So you've already kind of know this didn't do me well, this does me well, right?
Osteostrong did me right.
Right, there you go.
Everybody knows.
So everybody, yeah, so you always use yourself as a gauge.
What company do you use for genetic?
I use MaxGen. It's the most comprehensive test that I found on the market. If you find another one that's better, let me know.
How many genes do you test?
Oh, so many. It's like a 20-page information
How
of the
much
test.
does it test?
The test is 500.
And it comes with the description how to approach your.
Of course, so that's what you have me for. So it's a 20 thing, it's how do you interpret 20 pages? So I only pick out what's relevant for you because let's say you're not gonna quit smoking right now, I'm gonna skip that section, that's not important for you. If you're for weight loss, maybe it'll tell you genetically a GLP-1 like tirzepatide is good for you, or berberine is good for you genetically. So if you're working on weight loss, I'm gonna focus on that section. So I very much customize the test to you and we go over that together. Yes, dear.
Yes, I have a question. You mentioned earlier that air fresheners and And scented candles, they're bad, they're toxins in it. What would you recommend to use to substitute those items?
Essential oils, like a good quality essential oil, like a pure one. Yeah, so yeah, I mean, I know doTERRA is like a MLM, but I find the quality to be quite good, or Young Living is also a good one. They make these new ones where it's a plug-in and you put the essential oil, you turn it upside down, and I have those in my bathrooms.
That's what we got here.
Yeah. I can smell the eucalyptus.
Thank you.
Have you heard of Swiss Jus essential oils?
Which one?
Swiss Jus essential oils?
It doesn't mean it's not good. A lot of my patients send me the back of their whatever it is, like their deodorant, and I let them know if it's good for them or not. I have to look at it.
Another question.
Yeah, go
sorry.
for it.
What was the book that you recommended? What was
Good
the-
Energy by Casey Means. Yeah, I think everybody in this room, if you're interested about your health truly, you should listen to that book.
I'd say just to add on to that, Joe Rogan actually interviewed her and her brother both.
Right.
It's almost a 3-hour-long podcast. Phenomenal for the stuff we're working on here as far as biohacking goes.
Yeah.
Just kind of introduction to kind of what we talk about in a very high-level conversation, honestly, I would say.
Thank you.
Yeah,
Anything for traumatic brain injury recovery?
a lot.
A lot.
Yeah, we can talk
Yeah,
one-on-one.
okay.
I can give you a lot of information for that, yeah. It just depends, like, again, I individualize, there's many routes, it just depends what you would prefer and what's good for you. There's a lot on that. And there's one person, hypnotherapy, the person sitting behind you is excellent for that.
She's working a lot. She's phenomenal.
Yes.
To what extent do you work with peptides?
So I use peptides sometimes because peptides, you have to cycle them. So I don't use them long-term, but I use them for specific reasons. And again, it is individualized for the person. So for leaky gut, sometimes I use BPC 157. I do use microdosing of tirzepatide for short periods of time. I don't like that to be a long-term thing, just to give people a boost if they are overweight, diabetic, or obese. But I don't like to have people on that for life, because you can go to another practitioner and have that pen in your back pocket for life, but that's not what I do. I help people make transformations and change their life so they have a healthy lifestyle. I don't want people to depend on these
The
things.
crutch versus.
Yeah, I don't want them to, it's a good tool. I love peptides, but again, I use it for a certain period of time for a specific reason. And then we cycle off. Yeah.
How much sleep should somebody average age get at 17?
It's not necessarily about the time. What the study shows is at least 6 hours to 8 hours. Sometimes some people need not 9 hours, but it's more about the quality of sleep that you have. What's your deep sleep and what's your REM? So it's good to have some tracker to know where you are in your REM and deep sleep, because you want quality sleep. It's more also about how you feel. So you should wake up feeling refreshed. You should not wake up feeling fatigued and tired and dragging through the day. And that's potentially sleep apnea. That's another issue that has to be assessed. So it's more about the quality and how you feel, but roughly 6 to 8 hours is what the studies show. Some people even need 9.
Is there a way to assess a person individually as to how much sleep they need?
So I have a test that tells me whether you're genetically more prone to have more or less sleep, but not specifically. What we kind of go by is those markers when you're using your own wearables, and to see if you're in that deep zone or not zone, and then individualize too. How are you feeling? Do you feel good? Again, what Casey Means said, are you feeling good most of the time, or are you feeling bad?
iWatch has a function that you just hit sleep. I do it every night. I wear my iWatch and it tells me how long I've been in REM, how long I've been in deep sleep. Every single night it tells me different.
And that bed I have also, like, it can assess where I am in sleep. So let's say I put my alarm for 7 o'clock. It may wake me up at 6:30 because I may be in a better state. It'll detect where I am in my sleep to wake up at 6:30 versus 7 o'clock. I might be more drowsy if I wake up at 7 versus at 6:30 where I'm finishing my cycle of that sleep, if that makes sense. So that's a biohack again to optimize your sleep, is that I find it worth it. It's changed my life and a lot of my patients' lives.
Do you have a test that tells you your cellular age?
Yes, so that's what Jillian was talking about. It's called the true age test. Yeah, your biological versus your chronological age. I love doing that test because I can see if you're aging or anti-aging, and then we assess why are you aging, what doesn't belong, what part of your health. I use other tests to assess why that's happening. Yes, it's a great test. Mike, right?
Yeah, absolutely.
Yes.
Yeah. So you opened that you're from LA. Are you a local now?
I'm a local now, so I've been
where's
a
your-
local for 4 years.
Okay.
But I'm originally from Los Angeles. I still have my concierge practice there.
Okay.
But I
Where
have
is it here?
Huh?
Where is it here?
Summerlin. So my office is on Sahara and Fort Apache.
Oh, okay. So
Yeah, I'm right
You have a
down the
card?
street. I do. I have cards on me.
Yeah, I've got
Fantastic.
cards up front too for her and.
Cool.
Yeah.
Are you cash over?
So.
Meaning your clinic only takes cash?
So the only thing I can put through insurance that insurance will cover is blood work. And I can do a lot of good blood work because most primary care doctors order a quarter of what I order. If you've done blood testing with me, if you know, it's like at least 14 vials. It's extensive blood work. So that's the only thing I can put through insurance. Unfortunately, most insurance doesn't cover the functional medicine tests. Although it's very valuable information and I get people to the path to healing with those tests. But always where I start usually is blood work. Blood work gives me a good base of what in general is going on in your body. Any other questions?
Hannah, what biohacking protocols do you like most for increasing your energy at cellular level?
Well, first we have to find out why you have an energy problem.
I don't.
No, he doesn't. He does not.
But what-
Everybody that knows.
I'm curious to
If
learn.
you're already like,
Yeah, but we can always go, right? We can always
so
go.
then we need to talk one-on-one because I've individualized to you. My protocols aren't cookie cutter. So that's good that you're starting already at not fatigue because most people come to me and say, I am tired, I'm waking up tired, I'm falling asleep during the day, I'm exhausted, I just can't keep going. I have to drink 8 cups of coffee, I have to take all of these stimulants, and I don't know why I'm tired all the time. So you're already starting at a good level.
Well, Scalar Energy, Dr. Tennant, there's some cool stuff on the other side of town, EP Systems, which I love. It really comes out, I feel amazing after that. But that's why I'm here. So now I'm gonna get to everybody.
Let's talk about it. Any other questions?
What are some therapies you provide? You have a dude or can pass?
I use direct IV ozone, so direct injection of the gas. Yeah.
I'm one of her patients with that.
Hmm?
I'm one of her patients with her direct injection.
Yeah. So I don't pull anything out. I don't have to give you heparin. I'm a minimalist. I'd like to do the minimal amount with the most amount of benefit. So that has been my favorite modality for biohacking. And I created those protocols for biohacking. I'm a trainer for that kind of IV ozone. I train other practices on it.
Did that hurt?
Does it hurt?
The
It's-
ozone, I heard they hurt.
It
Some
hurts?
injections.
For the last 8 weeks, 9 weeks.
It doesn't hurt. And also, if you're scared of measles, it's a pediatric needle. It's the smallest
I
needle.
heard that they.
So if you're scared of needles, it's actually like the smallest
They say
needle
you
across.
just insert this close to a nerve, it can be very.
Well, that can happen with any injection. If you accidentally hit a nerve, of course that can be painful. That can be just even by getting a shot, if you hit the nerve.
She's very good at IVs.
Thank you.
How long does the ozone treatment last? How long does it take to do that with the injection?
So I use incremental dosing, so it can be anywhere from 5 minutes to 25 minutes. It just
Oh, okay.
depends.
Okay.
Mhm. I do,
So it's not
I
like-
individualize, like I talked about individualization, which is how healthcare should be, is I first start a loading dose, I see how your body does, and each time I increase it a little bit.
Okay.
And we always talk back, how are you feeling? Did you have any symptoms? Are you feeling good? Most people have energy and they want to go clean their house. So it's usually good time.
Well, I'm not sure I want to go clean my house, but there's other things that I
Well, go for a run, or go for a run.
Yeah.
Right before you go for a run? Go clean this house. How kind of you.
Is HRT included in what you work with?
It has to be. Yeah. Hormones, it's part of your body, right? It's one of the most crucial, important parts. The pancreas is a hormonal organ. That's insulin resistance. The thyroid, the pancreas, and the female hormones and the male hormones, you're one body. They all work together. We have to optimize all of those. I check all of them. And cortisol. And melatonin.
Do you have a line of supplements that you sell here?
I don't have my own personal line, but I do sometimes customized vitamins. So again, I individualize to the patient. So if you're a person who's not really good about taking a lot of supplements, I can actually make a powder or pill with exactly what you need for most of the things. So like I can make a specific multi based on your blood work because it needs to be specific to you. Or if you need like some stress support, I can also add that in. Or for like heart health, I can add some red rice yeast. So depending on what's going on, I can customize a vitamin if you're not a person who's good at taking a lot of supplementation. A lot of people get very supplement fatigued. If you've seen Brian Johnson, he takes a lot of pills. If you saw his list on the screen, you're like, wow, that is a lot of supplement. I don't do that much, but it can be a lot.
That's great, thank you.
Most of my patients have a pill box.
I have a pill room.
Yeah.
Yeah.
Well, there you go. I have a pill pharmacy at my house. I mean, like I have a pill for everything that you need.
I have a phone full of notes, and outside of sleep, which I consider number one, what are the top 3 things we need to do to follow the majority of the ship list? Boil it down.
Oh man,
That's
you're
good. He's good. He's good. I didn't warn you about Robert. He's good.
the top. So sleep goes. That's number one.
Yep.
Stress is going to be number 2. That's a big killer in this country. Yeah, and then the last one is going to be, you already took it from my brain, it's going to be inflammation. Getting that inflammation down in your body, that's preventative of disease. Those are the top 3. That's a good question, Robert. Yeah. He's like, I know.
He's a good student. He's a very good student, trust me.
Yes.
Emotional regulation is, I'm learning, is like really.
Where'd you get that one from?
So I also want to take a step back. I was talking to Roberta earlier. So I have a triangle, okay? It's mind, body, spirit. That is a true path to longevity, okay? I mainly work on the body. I at the end of our customization plan, I always have a list of practitioners depending on what's your cup of tea because it depends on you. So if you are more going to be into hypnotherapy or EMDR or whatever it is to work on the past trauma or the issues, you want to go and see those practitioners too, because that impacts your physical health. So much of what we do is subconscious. If you don't get to that subconscious, you can be running a pattern every day that you're not aware of. You may be getting an anxiety attack at looking at a light and you don't know why that causes you anxiety. You have to go back into that subconscious and what happened to me when I was 5 years old that caused me to be scared of the light. So you can, once you fix that, then you won't get scared when you look at a light anymore. So you have to work on the other parts. I personally do it. I practice what I preach. I do something mind, spirit every week as well. Like tomorrow's my day. I'm gonna go do an energetic session. And I work with a lot of people, so I always have to be on top of my game so I can help take care of everybody else. Plus I have a husband, plus I have a father-in-law I'm taking care of, plus my dad, plus I have 3 kids. So I need to make sure that I'm good so I can help everybody else be good. Yeah, it's really important.
Can you explain EMDR for people that don't know? I'm a big believer in it. I've done it for a while, so I kind of.
So I'm not a specialist in it, but it works on trauma. It's covered by insurance.
Yeah.
I know that. Are you an EMDR person? There you go. I'll have her answer.
I'm movement desensitization and reprocessing is what EMDR is. And I mean, if I'm going to speak to it, I'd say that hypnotherapy is actually going to be better for you. You want to stick with Roberta right there. But yes, I am trained in EMDR, and it's about bilateral stimulation and using both sides of your brain to treat that trauma and work through it. It's pretty cool.
So our immune system, huge, right? We all learned that a couple of years ago with the crazy shit that went around. So talk to me about.
It shall not be named.
Scandemic.
We're all friends here.
Yeah. So what do you recommend to boost our immune system?
So I do a lot of immunity boosting because again, I work on cellular health. That's at the core of your immune system, okay? So you have to work on the cells and then the immunity boosting things in your body. We have to keep them at its high pace. I'll just give you one freebie is vitamin D. Vitamin D is good for mood, good for bone health. It's good for immunity boosting. I'm very strict with vitamin D. I like people 55 to 85 because 30 is the conventional number and right before 30 you break a bone. So why would we decide that 30 is the number? I go more by the Board of Endocrinology. So it needs to be 55 to 85. So you have those resources. If you get sick, you have that vitamin D to support you. So that's one thing that I look at, but you have to look at all the micronutrients. Exercising, all the other things that, you know, keeping stress down. Like if you lower your immune system, that's what's gonna let everything in. Yeah.
Yeah. I have another question.
Do you work with people who are autoimmune?
A lot.
A lot.
I've been able to reverse ANA from positive to negative a lot of times when we find the root cause.
Okay.
Not cure, but it's positive and then it's negative. When we find out what's the offending factor that's causing autoimmune, it's not natural for the body to be attacking itself. I think everybody can agree that that's not normal. Just from a logic standpoint. Thank you. Something is off. The body, something's out of balance. And basically, it's very simple. The body's out of balance. We got to put it back in balance and give it the support to do its job. It's very simple. I take the complicated part. I help figure out all of the little intricacies about that. Yeah. You had one more question?
How long is I have two. How long does it take to get the results of the testing that you did?
It depends which test. So like a blood test, I have a lot of send out to the Cleveland Heart Lab, so sometimes that can take a month because it's very specific markers. A food sensitivity test can take 2 weeks, gut health can take 2 weeks to a month.
But you
So
mentioned genetic testing?
genetic tests can usually take a month because it's a genetic test. Yeah, that takes a while to run that one. Yeah, it just depends.
What can you recommend for people who took the vaccine and to make sure they get all those
Ooh.
policies out?
I would touch that one. Great.
You gotta see me one-on-one for that one. There's stuff we can do. Okay? There's a lot of stuff we can do.
30 days.
Yeah.
When you do DNA testing, how do you work with the companies to make sure that your DNA stays unknown and secure, and is it put into a database?
It's
somewhere?
not 23andMe, and it's a private company.
Okay, but even that is, do they mask who you are so that nobody knows? I mean, because even a lot of times when you send that in, it's still, people know that it's yours and it's in the database somewhere.
I'll have to check on that. As far as I know, I mean, because it's a medical company, it's a
Yeah.
one-on-one database, and there's also privacy laws.
Yeah.
I know.
Yeah.
I
We
know.
can have all the laws we want.
I know.
Yeah.
Siri's listening to us now, right?
Right. Thank you for being honest about it.
I will have to, it's a good question. I will look into that.
When it comes to you and money's no object, blood tests, genetic tests, what else?
Blood test.
She just upped her price for you.
The guy in the front who's asking all the tough questions. If I had, the top tests are the genetic tests, the blood work, the epigenetic test that tests the biological versus chronological age. If you're willing to do the oat test without coffee, because you said you don't, I do that one on you. The gut health test, food sensitivity test, total toxic burden to check all of the offending factors. It's like probably like 8 tests. Okay. Well, I told you, come to me one-on-one, we'll talk. I got you.
You're being good hands.
Do you have much experience with gastric bypass patients?
I've had one, so yeah, one patient.
I do the same.
Yeah, I have some experience. And also, look, I'm not prideful. If I cannot take you, I will send you to somebody else who can or who can help you, or I will consult with somebody who specializes in that. So sometimes also specialists, because you're not at the point of disease, they won't take you, but I still want to run the test. I'll talk to the specialist and I'll ask them, what test do I need to run to check for this before I send them to you? So I do contract with a lot of specialists because at the end of the day, it's about people helping people. I want people to be at their best. We're in a really big crisis in this country, a big metabolic crisis. So if I can help like a one-on-one patient get to their maximum benefit, I feel like I've done my purpose.
Well, she had the gastric bypass maybe 10, 15 years ago, 20 years ago. But the doctors right after her bypass said, well, we're not doing that anymore, so you guys are on your own. And they just cut everybody loose with no explanation. We're not doing this anymore. And there's nobody else in Vegas that we can find that works with that.
Interesting. Well, let's talk one-on-one. I want to know why they won't do that either. Yeah, let's talk.
Do you find that some people start with the deficit already, so just their baseline? And is it usually due to genetics, or is it due to environmental or behavioral factors?
So I will say most people, when they start with me, I find something that's off. Because again, I'm more strict than most people. I work with preventative health. So if you haven't worked with a functional medicine provider before me, a lot of time we're starting from ground zero. And I'm very honest with people when I do their consultations. Sometimes it can take about a year to get in a better place.
I've done a lot of functional medicine before. I think that the context of the question is my partner does everything wrong and he's great. And I feel like I do everything. I try to do most things right.
So genetic plays a role. My husband's one of
that's
those.
what I was asking.
And he's my husband is my worst patient. But he will give me his arm for an IV and he will take his supplements. But he also does everything wrong metabolically, and he has the best epigenetic test score I've seen. He's one of those people that we love
so you do
so
find
much.
that it's due to genetics.
Genetics does play a role. So like, let's say their family are centenarians, they're likely going to be a centenarian. They can smoke all day, they can drink wine, they can do all the wrong things, and their genes are just that good. They're very resilient. So genetics does play a role. However, it's not everything. So there's still maybe some other deficits that haven't been looked at if he has not seen a functional medicine provider. A lot of conventional medicine will say, I can't find anything. They're also not looking for the right things, and they're not looking in a preventative way. So everything may look good on paper, but what's the breakdown of the cholesterol? What's the LDL particle number? What's the LPPLA2? What are all of those markers that are going to cause an issue down the line? Are those markers good? Are they not good? What's the insulin level? You know, a lot of those things.
Okay.
Yeah.
What percentage would you say genetics contributes to all of this?
It's hard to say because everybody is so different, but I will tell you that epigenetics plays a big role. So even though so many of your family members has a heart attack, doesn't mean you have to have a heart attack. It's your blueprint, which means you were born with it, but it's not your destiny. So what we do in our environment, whether it's what we eat, you know, how we exercise, like literally the country we live in, can all affect those factors. Your mindset is also a big one. So I remember I'm still talking from a physical perspective. There's also like how you think. That communicates to your body. If you have a very strong mindset, a lot of stuff is not going to shake your body. Like stress won't affect you if your mind is very strong, so you won't get that impact. So that's also plays a role too. It's not just one thing. I can't give you a specific number because everybody's so different. And again, my lens is different than most people's lenses.
That was really helpful. Thank you.
I have a question. My partner couldn't make it. She has a question for you.
Okay.
What's your knowledge base on MTHFR?
Oh, good question.
Because she has one.
I can do a talk just about this. So roughly 50% of the population have the MTHFR gene. I love that genetic test because it tells me which types you have. And it tells me, I love Gary Brecka, but he got this one thing wrong, that everybody who has the MTHFR should take methylated vitamins. That's not true.
Correct.
So depending on which ones you have, you actually might be overly sensitive to the methylated vitamins and you should not take them. It could actually make that methylation pathway way worse. So I recommend getting a genetic test. You can even get it at Quest. It won't give you like the detailed one of a genetic test of the breakdown, but at least you'll have a basic test. I get really heated about this because also for women who are going to get pregnant and who get genetic tests, they can just add that on and they do not add it on. Why does a woman have to go through 3 miscarriages to then go get that tested? Why did we have to do all that trauma to her when we could have just tested it in the beginning and just known with all the other genetic tests that we do? I think everybody should be tested for the MTHFR gene. You need to know if you have it or not because it can cause issues down the line with what you eat. That affects what you eat, and that's why I like this test because now I can make specific recommendations of the supplements you take, of what you eat, because it really matters. And just so, if you don't know, folic acid is pretty much in everything in this country, and it poisons that pathway. I have MTHFR, I'll openly say that, and all my kids do. So I even test kids because when that isn't optimized, that looks like ADHD. That can look like rage. That can look like bipolar. We can save a lot of kids from going on medication by doing this test. It's so important. So I get like really
Yeah,
like
what color you
passionate
got
about it.
excited
I get
about?
really passionate about it because this is something that we can do as far as prevention in this country. I think everybody needs to be tested for it. Even your doctor, if they're cool, you can ask them, can you test for the MTFHR gene on my next blood work and see if I have it? I just err on the side of caution until I know if somebody has it or not. If they don't do the test with me, I give them non-methylated vitamins because I don't want to send them the wrong way and then they're not happy with me either. And their spouse isn't going to be happy with me either.
Thank you.
Yeah, great question. Really great question. Very important test to do. And that affects your cells, your aging, methylation. Now methylation is actually becoming more important than telomeres. Like telomeres is like 20%, methylation now is becoming 80% of how you age. It's becoming really, really important. Any other questions?
Who's ready to take the test now on everything she said?
Why not? Who wants to give me the top 3 takeaways? Robert?
Sleep, inflammation reduction, I'd say stress reduction. Probably.
It is.
So I hope I gave you guys some good take-homes, some things to think about. Hopefully some tips for your own health that you can incorporate today, some things to take note of to ask your doctor for on your next visit.
I do a functional medicine doctor, but I've never heard him discuss some of the things that you mentioned. Could I see you specifically for certain things, or do I have to be your full-time patient?
No, I have specific visits too.
Awesome, thank you.
I love it. Anything else for her? Did she do good?
She did great.